Hi, everybody. This is Heather Hampel, Associate Director of the Division of Clinical Cancer Genomics at City of Hope. And just wanted to talk to you a little bit about an important update that happened to the NCCN guidelines for genetic/familial colorectal cancer this year. So I want to just show you the page and talk about its impact. So here we go. Basically, these criteria are the criteria for when to consider genetic testing for a patient based on personal and family history of cancer. There's obviously also the big change from last year where for anyone with colorectal cancer, you can actually consider moving straight to a multi-gene panel test. But for places that are using family history-based criteria, you move to this page. And the really important change is that this right here used to be for an individual with colorectal or endometrial cancer and any of the following, which was great, but there are a lot of Lynch syndrome associated cancers that were just being left out because of that. So now it reads an individual with a Lynch syndrome associated cancer in any of the following. So that basically opens up testing quite a bit because, as you know, there's a long list of Lynch syndrome associated cancers, and it's included down here in footnote B, but includes, besides colon and endometrial, gastric, ovarian, pancreatic, urothelial, brain, typically glioblastoma, biliary tract and small intestine, as well as sebaceous adenomas and carcinomas and keratoacanthomas. So basically, now if you have a patient with any of those tumors diagnosed under 50 years of age, we recommend testing based on the NCCN guidelines. If they have one of those tumors and a synchronous or metachronous additional Lynch syndrome associated cancer at any age, so this could be somebody with endometrial cancer at 70 and colon at 80, meets criteria. And people who have any Lynch syndrome associated cancer and have a first or second degree relative with another Lynch syndrome associated cancer diagnosed under 50. So if the proband is under 50, they already meet, but say the proband's 50 or older and has another relative with a Lynch syndrome associated cancer under 50, they're going to meet criteria. And then lastly, of course, 3 cases total of Lynch syndrome associated cancer now, regardless of the ages of diagnosis. So I think that everyone's going to find that most of the patients now where you're suspicious of Lynch syndrome will meet criteria, and this is going to be a really good thing for our patients, who is going to give a lot more patients access to genetic testing. So hopefully that was a good change, and it's an important one for you to be aware of. Thanks so much. Bye.